The government has today announced how it will spend what it's calling a $100 million social investment fund for mental health. You will have heard details from our health reporter Karen Brown in the 5 o'clock news. While the extra funding was known, some details have been released on where it will go, including new initiatives around prevention and early intervention. But it doesn't appear that any of the money will be used to increase the pay of workers in community mental health care. And in a high-level document leaked to Checkpoint, we'll put it online shortly, the Ministry of Health is warning DHBs against doing exactly that. Sent to all District Health Board Chief Executives on the 7th of July, the Ministry describes increased funding for mental health providers struggling to retain their staff after the pay equity settlement as unlawful. Now, since the pay equity settlement saw increases for workers in aged and residential support care, but not for workers in mental health support, the mental health sector has been losing existing workers and struggling to attract new ones. One DHB told Checkpoint there's an impending catastrophe in the mental health sector if workers can't be retained. But the Health Ministry document, obtained exclusively by Checkpoint, seeks confirmation that DHBs do not intend to provide increased funding to providers and that they'll cease if any initial payments have been made. The Ministry wouldn't talk to us, but a union representing some mental health care workers says the Ministry's letter is outrageous.
I'm totally shocked at that. I just cannot understand why the MoH would do that.
That's Kerry Davies, Assistant National Secretary of the PSA. Now, the settlement itself was announced by Bill English in April.
Cabinet today agreed to a $2 billion pay equity package to be delivered over the next 5 years to 55,000 care and support workers employed across the aged and residential care sector.
But not community mental health support workers, who often do similar work to their colleagues in aged and residential care. Previously, the sector had a kind of low-wage parity, but since the settlement, the difference has become pronounced.
At the moment, mental health support workers generally earn between $16 and $19 an hour.
So $16 to $19 an hour for mental health support workers, while the basic rate for care and support workers in aged and residential care
is from $19 to $23.50 an hour.
That's an average of 20% more, and that's so financially significant, it's beginning to hurt community organisations providing mental health and addiction care.
They're losing staff at a time when we need mental health to be as strong, and addictions to be as strong as we possibly can.
That's Marion Blake, CEO of Platform Trust, a national network of community organisations involved in mental health and addiction services. The pay gap, she says, is beginning to have a serious impact.
So not only are people leaving the mental health services or have indicated that they will be leaving, it's also becoming increasingly difficult to recruit people because people can be paid a higher wage, sometimes as much as $6 an hour difference by going to work in the disability services.
The response? Well, an internal email from the Ministry of Health to the country's DHBs, leaked to Checkpoint, makes it clear that, and this is a verbatim quote,
some district health boards are proposing to fund their contracted providers additional amounts to enable them to pay their mental health workers for providing mental health services at the minimum wage rates of care and support services.
In short, to stop mental health workers from leaving for better pay in aged care, DHBs are proposing to pay their community mental health providers more. The Health Ministry's response to this, in an email sent to all the country's DHBs, is to, quote,
seek your confirmation that you do not intend to provide such funding or will cease it if an initial payment has been made.
That email, leaked to Checkpoint, calls an increased payment unlawful in capital letters and warns of, quote, legal and associated risks with making such payments. Later it says any payments already made need now to, quote, cease. Why? And what are the DHBs and community mental health providers meant to do to retain their workers? The Ministry declined to be interviewed despite repeated requests and despite the fact it's their document we're working from, a document they sent to the CEOs of all 20 DHBs. I asked the Minister what he made of it.
Look, I'd have to see the document and understand the context of it.
So the Ministry sent out the document a month ago and the Minister doesn't know about it. Which brings us back to the reaction from the PSA when we told them about the document earlier this afternoon.
I'm totally shocked at that. I just cannot understand why the MoH would do that, why they would put a limit on what DHBs can fund and also what NGOs can actually pay mental health support workers.
The PSA and E2 have filed a claim with the Employment Relations Authority to effectively get mental health workers into the settlement, pay equity settlement they were excluded from. But in the meantime, the community mental health sector is struggling to keep workers and struggling even more to hire new ones.
Yes, we're getting reports from our members that they are moving into other jobs within the care and support workforce and leaving mental health support services. And that's very difficult because people are very committed to mental health support services, but they're also committed to supporting their families, and they need decent wages to be able to do that.
That's the PSA's Kerry Davies. Marion Blake, who represents many of the employers, emphatically agrees.
It means that, organisations who have been struggling, John, over the years they've been struggling, and this is just adding more to it. And I can see organisations closing down. So it's a mess.
It's Marion Blake. What does the Ministry of Health say? Well, once again, they declined to be interviewed, but they did send us a short statement. It says, while the Ministry has appreciated well-intentioned and equitable consideration by some DHBs, it was necessary to make it clear that all funding paid to DHBs through the Ministry had been specifically appropriated by Parliament for a purpose. While it was clear that no pay equity funds could be used for mental health workers, nor could general funds be used for the purpose of a top-up to contracted providers for their mental health workers. Additionally, since the legislation came into force, a claim has been lodged by E2 and the PSA seeking pay parity for mental health workers. That's the Ministry's statement. We will put the Ministry's letter to the DHB up online. The first words are unlawful payment in capital letters.